Hey friends, welcome to the Ancient Health Podcast where East meets West. I'm your host, Dr. Chris Motley. Today, let's talk about small intestinal bacteria and yeast overgrowth. Acronym is SIBO, small intestinal bacterial overgrowth, because I did a reel on Instagram and on TikTok, and it got a lot of response because it talks about the signs and symptoms of having small intestinal bacterial problems and how it shows up on the skin, how it shows up as neck pain and shoulder pain and even headaches and TMJ issues. And those signs and symptoms are hidden below the surface, things that you would not expect to be associated with your small intestine. And many people were very, aware of it because they're saying, I have those symptoms. I did not know that was small intestinal related. So let's go over those signs and symptoms because I want to clarify it to you. One side note, I am a little nasally. I apologize for that, but I was doing a cleanse. So if you can see me on camera, or if you're just listening to this, it's DesBio's. It's called an SSR kit, and it's a series kit. Basically, it's a cleanse for Candida. So I've been doing a Candida cleanse. I did that, plus I did laser therapy on my chin where I had an old cavity a long time ago because that's an area that had Lyme disease in it. And it was always an area where the tooth always ached. It had some bleeding around the gum, and it always got trapped food because the gum was so weak. Going to a holistic biological dentist, they found an old cavity. This is a long time ago, and they said we need to keep that area really clean. So I started using laser therapy and red light. Shout out to also biolight.shop. They have a mouthpiece, biolight.shop, and I put that in my mouth to put red light on my gums almost every night. And I have an Avant laser. It's a therapy laser, but I use a violet light on my chin as well, right here on the jaw. You can investigate that and use the red light you want. But as I did this, plus this cleanse, I felt my lymph nodes, my throat start to drain the fungus and the toxins, and it made me lose my voice for a day and a half. So I took my supplements, kicked back up, didn't get sick. I just felt a little nasally and congested. So I had to shoot this, and hopefully I sound decent enough to get this thing recorded. But now we're going to talk about those subtle signs and symptoms because people like to know about the hidden things. So we're going to talk about those hidden signs and symptoms of SIBO, what you could be noticing and didn't contribute to your gut. Number two, how do we help treat the SIBO? What are some of the herbs and things I recommend? What are some of the self-therapy, like the acupressure points you can do, which would help tremendously. So don't ever underestimate those things. They can help very well. Also, number three, do the food intolerances or sensitivities show that you have SIBO? And the answer is yes. We'll go over that. Number four, how to treat SIBO in children, because it's hard to get them to take many supplements. Hard to get your children to eat certain foods because I know it's tough. They just don't want to, and I get it. It's very tough. So let's just go over some thoughts and recommendations. Also, number five, what tests would you recommend for SIBO or lower intestinal bacteria? There's a few, but we want to keep it simple. So everything's clean and simple, and we don't want to make this confusing. So number one, what are some of the signs and symptoms? So if you guys can imagine, if you watch me here on the camera, I always use my Chinese medicine doll. If you look on the hand, on both sides, acupuncture meridians run bilateral. If you listen to other influencers or other doctors, practitioners that use Chinese medicine, they may have a better explanation of this pathway. But the small intestine meridian starts at the pinky, on the outside of the pinky. You know, when you karate chop somebody, you go up to somebody and you go, hi-ya. Remember when you're a kid and you do karate and ninja work and you chop somebody, but on the outside of your pinky, going up the outside of the finger, up the outside of the wrist, that's where the small intestine meridian starts, literally. So you could have pain on the pinky, you could have pain on your finger, you could have pain on the wrist. Now, one of the most popular points is small intestine 3, 4, and 5. You can treat those areas. It's really good for the bowels. But that meridian will keep traveling up the side of the forearm, the outside edge of your forearm. If you feel your outside forearm bone, okay, it's called the ulna bone. And as it goes up into the elbow, the meridian of the small intestine, it travels up the back side of the arm. So it travels on the tricep area. It'll go up to the back side of the shoulder, and it does a zigzag pattern around over your shoulder blade. Do you have chronic shoulder blade problems? So you guys are following me here. The pathway means a lot. Then the meridian over the shoulder blade goes up to the back of the upper trap, and then it makes its way up the side of your neck, and it will push over from the side of your neck up to your jawbone. Here's a kicker. From your jawbone, it comes up to the face and it has a point right on the side of the cheek. You ever get a breakout or pimples right at the side of the cheek, right near the actual plump area of the cheek? That's a small intestine point. And this small intestine point is around the 17 and 18 point. And eventually that point on the outer edge of the cheek will shoot over to the area near the TMJ, which can cause TMJ issues at small intestine 19. So imagine that pathway. So what happens is you have patients that can have problems along this meridian pathway, and it points to small intestine issues. Quick story. I had a patient, we've been working on her staph and strep, doing really well. Worked on some Lyme infections in the gallbladder, started to clean that up. Some of the signs and symptoms she's had has gone away. But she always had problems still with small heart tachycardia issues, heart inflammation, chest tightness. And we had cleared so many things up that we had made such good leeway, but I had to pay attention to those small signs and symptoms. And why is it related to the heart? When you eat food, the stomach dissolves the food, right? Dissolved food goes down into your small intestine. Small intestine takes the dissolved chyme, the broken up food, absorbs the nutrients of it, sticks it into the arteries on the outside of the intestines, and that blood goes up into the liver. The liver cleans the blood, takes the blood, then shoots it up through a vein up into the heart. So the small intestine eventually feeds the heart. That's how Chinese medicine sees the fire element. Fire means energy. Food creates fire. It creates energy. Small intestine sends that energy up to the heart through the blood. So this is important. Hope this makes sense. So she was having still some heart palpitations after all these things were cleared up. But I started to notice as I was checking her that she had small intestine reflex points, pulse points on her wrist. In Chinese medicine, you check the pulse points along the wrist. You can check the tongue. You can check the eyes. You can check the skin patterns on somebody and see if they have small intestinal issues. But I always check the pathway of the meridian, the one I just mentioned up the side of the hand. I said, do you have any pinky pain, any pain on the hand or the wrist? No, that's fine. But I do get sore when I write or type for long periods of time. That's a big indication that could have some digestive issues. Sore wrist, even carpal tunnel pain. So then I go, okay, that's number one. That could be a small intestine issue. The next thing I asked, do you have elbow pain? No, my elbows don't really give me problems. But people with small intestine issues usually have elbows that will pop. They'll crack. Sometimes they get tightened up. Have you ever had that? They will actually take their own elbow and extend it real quick to pop them. Sore elbows, unexplained. Sore unexplained triceps, another small intestine issue. Take the back of your arm, squeeze your small intestine. If you have hidden digestive issues right now, well, not while you're driving, but when you get done driving, squeeze the back of your triceps and don't be light. Squeeze pretty hard and see if you feel tenderness. And you're like, well, I just worked out. And that's granted. If you worked out, this doesn't apply to you. But if you have random soreness on the back of your triceps, that's an indication that small intestine could be affected. Here's a big kicker. For her, she goes, yeah, I get these little bumps on the back of my arms randomly. I'll get eczema flare-ups. Before, I didn't see them. I had to look very, very carefully. I had to take my light on my phone and look at it, but you could see a light amount of breakout and rash on the back side of her tricep where the small intestine meridian runs right here, and up on her shoulder blade, she had discoloration on her shoulder blade, almost not impetigo, but almost a discoloration of the skin. And then I proceeded, do you get shoulder pain? She goes, well, my shoulders get tight, something that most people just forget about, like shoulder pain. But she had this breakout and she says, I've had it for as long as I can remember. I then said, do you get random TMJ issues? She goes, yes. She didn't think anything of it, didn't mention it. But TMJ issues where her jaws get tight and she gets locked down. So then my mind goes right into small intestine. Small intestine feeds the heart. Small intestine must have an infection in it, causing the skin issues, causing the TMJ issues, causing the wrist pain. You guys are following my reasoning. I said, well, okay, so the small intestine meridian runs on the shoulder blade. Do you ever have shoulder blade tightness where your shoulders get frozen up? She goes, not that they get frozen up, but my shoulders always feel sore at particular times of the day. I feel like I can't do a lot of workout because they just get too sore. So my brain's already pointing towards the small intestine. I keep repeating this. I'm sorry, guys, but you guys see how this is starting to fold out. And then I go into the emotions of it. The small intestine has to do with direction, vision, being able to be in touch with your own feelings and emotions. If you feel disconnected with your own emotions, apathetic, cannot connect with yourself, if you do not feel like you're focused in life, put those together. Those are big small intestine meridian issues. Or if you're dealing with somebody who does have that. So if you're dealing with somebody who has that, or you yourself have it, it could weaken the small intestine. How? Your small intestine's job is to take the food you have just eaten, the chyme, and get everything out of it. Does it make sense? Pull all the nutrients out of it. Extract the good things from your food. Pass along the waste. They say in German medicine, if you are not able to get the best things out of your life, if you've had trauma that's robbed you of the best things out of your life, made you starve for the good things in life. You guys follow my thinking here. If you can't get the best thing in life, but you had to hold on to the toxins, instead of passing on that old food you got your nutrients from and passing it to the colon, you're holding on. You don't have vision or direction. That can cause the small intestine to stagnate and decrease its muscular contractions, allowing the food that's already been nutrient extracted and pass along down to the colon. I said, do you have a lack of vision or direction? And she says, yes, I do. So right off the bat, I'm saying, okay, you do have these indicators. And her emotions, she almost started to tear up. She says, I don't have any direction. I don't have any focus in life. I'm too tired. She was a lawyer for the longest time, and dealing with other people's energy, other people's energetic, influence on her life really took it out of her. Have you ever been that way? For those of you listening, you're going, yes, I literally, look at my face right now, Dr. Motley. Look at it. Look at it. Every time I've had to be the person who fixed everybody else's problems. I've done it so much that there were so many people in my life that didn't have direction, and I helped them with that. And it eventually made me so tired that I lost my direction. And if that's you, listen up, because SIBO could be a big indicator of why you maybe have digestive issues, maybe why you have mood issues and problems. So she had these, and I checked her tongue. Middle of her tongue still had a big crease around that area, which is upper digestion. The back middle part of the tongue, the mid part of the tongue is more large intestine, had some thrush, a little bit left. So she was doing pretty good with yeast. But when I further checked her, I did find, after we cleared out strep already and cleared out some of the Lyme, that she had some different types of fungus. And those different types of fungus had a hold in her small intestine. And you have to be careful because these funguses and bacteria are very tricky. They find ways to hide in the intestines. So you can clear out all these other infections, but if they have certain ways to adhere or stick to the sides of the walls very, secretly, they will do it. And that's why we're going to talk about testing later, because if you get the testing done and you find those hidden gems, you'll clean those infections out. You'll start seeing a better point of life. So she had the infection on the back of the arms. I then proceeded to ask her, do you get bloating randomly? She said, yes, she gets bloating right in her lower digestive area. She bloats out. Sometimes her pants fit a little tight. And she started having like diarrhea sometimes, and she would have some gas. It's gotten a lot better since we cleaned her out. But she said, my heart still has a little bit of palpitations. So we started to treat the small intestine. I started using herbs, and a couple of them. These are not all specific just for the fungus, but they do help with SIBO. I started using this one. You can see on Morinda Supreme from Supreme Nutrition Products. It tested with muscle testing very well for her. So I found Morinda Supreme, and I found that Smilax worked well, which is a very big yeast fungus toxin absorber. Smilax is sarsaparilla. So it's sarsaparilla root, and it's really good to help absorb the toxins of yeast and endotoxins in general. It actually kills off a lot of Lyme infections. So Smilax Supreme. I gave her a light dose, 1 or 2 of each a day. And I gave her a little bit of Vidanga, which is a berry that is used to kill off roundworms. She had hidden roundworms in her lower digestion. So it helped her small intestine. So I gave her like 1 capsule every 4 times a week. We started to do that. We started cleaning her out. And I was doing a very light dose. She comes back, arms are looking better. Symptoms are down by like 40 to 50%. And she started noticing that her emotions got stronger. Like she could recognize when she was giving her energy away. And that's the point. She noticed her energy was being taken away. She's like, no, I got to set up boundaries. So then we started thinking about Bodyguard. I always modulate my supplements. I don't keep them on the same for a long time. We always change almost every single time. But Bodyguard's called Chancapedra, and it is a really good stone cleanser. It cleans out gallstones, kidney stones, bladder stones. So I gave her a small dose of this to clean out that gallbladder to keep it going, flushing. So we start to see her body start to flush these things out. And the goal was to get the small intestine to reveal itself, because her heart is taking the brunt of the blood that's infected, but her small intestine has gotten so good at adapting to this old hidden fungus and some of these parasites that it was okay with it. It was like, oh, I can handle this. But the heart's still saying, I'm still getting some dirty blood. After we started this, she says, I haven't had any heart issues, a little bit of shoulder pain, but no palpitations. So this is not a bragging point. This is not to do that. This is to say that the heart was an indicator that the small intestine was the big culprit. So if you have heart issues and you've got some of these problems I just talked about and digestive problems heavily, or your children does, clean out SIBO. Okay? So that answers number 1. Those are some of the signs and symptoms. Number 2, how do you treat SIBO? Now, there's a lot that can go through in on this. I like to use homeopathics to start out, plus the Supreme Nutrition products. So that's my recommend. I don't try to find every single nutrient deficiency, which I think is amazing when doctors do that. They'll find that they need more butyrate, you need more cloves, you need more probiotics, which are all valid and they're great. And I agree with that. But I like to say less is more when I first start out. So I do testing, frequency testing, to find out which homeopathic by DesBio I will use to actually clean out the problem. I use homeopathics to start off with the Supreme, because if you have a memory, guys, remember this, if you have a memory of an infection like a yeast or a SIBO, small intestinal bacteria overgrowth, if you've had strep since you were a kid, can you imagine how much you've had to adapt to the strep? You've literally had to adapt to the strep all your life. So you become accustomed to it, acclimated, and your body says, well, I got to deal with it, so I better make other arrangements in my body so that I can give space to this strep. And the strep's like, great, I'll just sit here and eat more sugars. I'll eat more nutrients that the cells have. I'll actually invade the red blood cells, and I'm going to move to other areas that have it. And this host can't do anything about it because I'm hiding. There are certain people that are strep carriers. And the doctors say, well, you're just a strep carrier, but you're not really active. No, if you have strep in your body, it is leaching the life force out of your body. That's really adamant for me to say, but it's true. I've seen horrible conditions with strep because it was hidden and they didn't treat it. So I do testing, and I'll test all my homeopathic kits from DesBio. I have this really cool plate that it's a testing plate by my friend Dr. Zev, and you can put the if you guys can see here on the screen, and it has a wire that you hook up to this machine, and you can check the EAV, the electro acupuncture voltage, and find out if you put the supplement on the plate. You guys can see me do this. It will measure the frequency of the supplement and see how much it affects the person's meridian. It can tell you if it strengthens it or weakens it. Isn't that really cool? So you can find out what strengthens the small intestine. That's just one way to do it. So if you guys are listening, find a person who can do EAV. Look into, these are treatments. Look into homeopathic remedies. I would look into DesBio personally, like to find out the practitioners who do DesBio, only because I'm so impressed with all these practitioners. They are smart. You cannot understand. When I go to these classes, guys, at DesBio, these guys and ladies are just talking. These docs and practitioners are saying some smart stuff, and I had to write stuff down and reread it. They're so smart. Now, I test like they do which thing shows up first. I naturally look for the SSRs. And that means that I try to treat the symptoms. And you're like, Doc, why would you just treat the symptoms? Because if your body is accustomed to the symptoms, like a sore throat, nasal congestion that's random, you just go, oh, that's happened all the time. I just get allergies. If you get used to it, then your body is acclimated to it, correct? It's acclimated. You get used to it. And so as you get used to it, I've got to get your brain to recognize those symptoms, to make your brain realize that those symptoms are not mine. They're not natural. They're coming from another source. So if you get the brain and give the body the frequencies it needs to recognize those symptoms, your body will start to release the biochemicals, the antibodies, all those cytokines to help clean up those things that are causing the symptoms. So then as you clean out the infections later, the symptoms aren't as severe. Does that make sense? You're teaching your body how to clean the symptoms. Get rid of that sore throat. Get rid of that headache. Get rid of that fever. Get rid of those body joint pain. You clean those out. And as you clean those out, after you do this Candida SSR, the company says go into the 1Ms, the strength, which is Candida 1M or Candida 10M. You get these box sets. And as you clean them out, you start to give the body the tools to find the infections in your cells or around your cells or in between your cells and say, hey, there they are. Go get them. Go get them. Because the body's just used to it. And like, oh, they're just hanging out in the yard. Oh, they're just hanging out in my basement. You know, I just let them play video games. And, oh, okay, that's another story. You know, it's just trying to be funny, but that wasn't funny. But if they're hanging around in your body needs to recognize them and go after them. So when you do a series like a SSR kit plus a 1M, then move to a 10M, and then maybe go to a HomeAccord, each practitioner has their own way of doing it. So they're all smart and brilliant. You can find a practitioner that uses DesBio. Go to their website, DesBio, and find out a practitioner near you. And find somebody who may do some EAV or do some different types of muscle testing or acupuncture or frequency testing, and get those homeopathic practitioners to help you with cleaning out these infections. I use mine alongside Supreme Nutrition products because as I loosen up the symptoms and the infections, I love to use herbs to go in it and clean those critters out. So EAV, DesBio, look into Supreme Nutrition Products website. The ones I just mentioned, I love Smilax Supreme for fungal toxins and endotoxins. I love Morinda Supreme because it kills off SIBO. It'll kill off the Candida. It'll kill off the strep. It's a great gut cleanser. It comes from the noni plant. And another one that I really find that's really great is Malia, known as neem. Malia, which is neem. Now, you say, well, Doc, which one? I always say Smilax in combination with Morinda has always helped really well. Neem seems to be, or Malia Supreme that I showed you right here, it seems to be a pretty strong one. If you have a pretty acute case of SIBO, like those things like really bad rashes on the back of the arms, really bad joint pain, I can't say Morinda or Malia, which one's better than the other. But for pretty strong cases, I do use Malia a lot. For SIBO in general, like a mild to moderately severe, I'll use Morinda. So I like those three, Malia or Morinda plus Smilax, okay? If you have those herbs, you can use any of the herbs they have on Supreme Nutrition Products. In fact, you can go on there and it has a product guide. It'll tell you how to use which ones for different types of fungal infections. Those are the three I like to use. But what I've noticed is as I start to clean out Candida, and they have other things on DesBio, if they have things for strep, which I've used a lot, I've used ones for bacteria, plus the Supreme Nutrition Products, I've seen people's SIBO start to fade. So please hear me out. You can use DesBio. You can use a strep. You can use a Candida cleanse. You just have to go back in your history book and find a person that does this kind of therapy and talk to them and see which is the most prevalent hidden infection and get that to bring back to the surface, give to your memory, and then use some herbs to clean it out. You don't have to use a ton of other supplements if you find the right ratios of the right supplements. But please don't give up. I know it's tough and hard. I get it. But if you want to clean these things out, you need to try to find a practitioner that can help you with this. But you can also learn a lot on your own. I know some individuals that do their own homeopathics, that do their own Supreme, and they do great. research there and find out things, and then send us some questions and some comments so we can help answer these on these podcasts. That's what we want to do, is make these like a Q&A at times. And if you like this type of style, let us know. So DesBio Supreme Nutrition Products. Let's keep it simple and clean right there. And if we need more investigation or explanations on the next podcast, we will. When we talk about treatment, we use these right here, but I use acupuncture or acupressure on the points. So what that means is I'll use acupressure on the small intestine. So if you have small intestinal issues and you have those little areas on the back of shoulders or arms, here's some good points. Press on the side where that little tragus area is on the TMJ. That's a small intestine 19. You can take your hands, don't press too hard. If you can see me right now, and you can do a nice circular motion on the areas around the TMJ. If you open your mouth and feel your TMJ moving and it's sore all the time, open and close and rub that point, but do it for 30 to 40 seconds, no more than that, 2 to 3 times a day. Don't overdo it. Then you can take your hand right here, if you guys can see me, where the karate chop is, make a fist. Where the knuckle, the big knuckle, where your finger meets your hand, the big knuckle there, the little creases it makes right there on the side of your hand, that's a small intestine point. Literally, you can reach in there. If you can see me on camera, you see my thumb? I'm reaching on that point and rubbing that point out, right where my pinky meets my hand, the pinky knuckle on the side of the hand. That can be very tender for many people. You can even tap the point. That's one in EFT, emotional freedom technique. Tap the point. So you do those 2 points. Another great one that I use on myself is tricep squeezing, tricep massage. You squeeze the triceps, and you can do that for about 30 to 40 seconds every day, 2 to 3 times a day, plus rubbing and massaging these points I just mentioned, and you will start to see your small intestine release with this other therapy. You're doing it yourself. Another one I love to do is I love to use a foam roller on the quads. The quads and the abdominal muscles in Chinese medicine and in kinesiology are related to the small intestine. So what you want to do is take a foam roller and massage your quads. Did you ever get sore quads? They always have to be stretched. Massage the quads and also do gentle abdominal muscle massage. You do those, you'll start to see the small intestine start to release. Now, you remember, you don't want to do it more than 2 to 3 times a day, 30 seconds to 40 seconds, maybe a minute a day, because you want to build it up. And what you'll notice is in your bowel movements, you'll start to have more mucus, you have more phlegm, you have stuff start to come out, and you're going, what is that? The smell will be even more. You'll start noticing that you'll get little caked up, hardened pieces of fecal matter because the small intestine will start pushing that old stuff out. You'll notice that your appetite returns in a healthy way. Okay, that's some treatment therapy right there. Those are your hands-on, do-it-yourself. Red light therapy, a laser therapy. I use, Avant, but you can use a great red light from biolight.shop. I don't get any kickback from them. You can use, there's many red light therapies, so don't get too caught up in it. But you can use that on the area around the navel, around your belly button. Put a red light on there. Pick a light, moderate intensity. Do it for about 5 to 10 minutes. Do it every day right on the intestinal area. Okay? You can do it at night. Do it with these massages. You'll start seeing your small intestine, your SIBO start to fade. Now, as this happens, we want to do it gently. And we want to get to the point where your bowel movements are, this is how you know you're healing, is solid, smooth, nice long shapes to your bowels. The smell may be moderate, but it shouldn't be so severe. And when you have a great bowel movement, this sounds very crass, but I hope it's not too much for you guys out there listening. But when you wipe, it should not be that messy. If it's messy, there's too many fats that are being in bile that's escaping into the poop. You want it to be almost where it's almost a clean cut. If you keep getting messy or have any anal discharge throughout the day, there's still SIBO involved. So that's how you know you're healing up really well. Less mucus, no runniness, no diarrhea, nice long bowel movements, soft, not too firm, and they don't create a big mess. So you know you're on the right track. Now, the third question was, do food intolerances indicate SIBO? And the indication, yes, it can. So food intolerances, especially when a person cannot eat sugars or starches such as cakes, candies, dairy, like heavy amounts of dairy. They can't eat, literally can't have a piece of pizza or can't do something with a little bit of extra sugar in it without this happening. There's a few examples. Itchiness or rashes on the back of the arms, itchiness on the skin or in the skin or under the skin. You guys have that? Like you feel itchy or feel irritated or inflamed all over. The gut gets a little inflamed, can get a little bit puffy or get stagnant or real tight. These are just a few. You don't have to have these all at the same time, just some of these. Tight jaws when you have this, or a headache. You can also have weakness in your legs, in your quads, your abdomen. So weakness in the legs. Also, too, you'll get gas after you eat the food. You'll get gas and like you'll keep passing wind, as they say in the British communities. You'll pass wind. You'll have a lot of gas. Sometimes it causes diarrhea. You'll get some cramping. If you have this after you eat a particular food, it's because you've mobilized the small microbes and they go eat the sugars and starches and carbs. And as they do that, it gives them enough fuel and they'll release waste, and it's the gas. And your body's trying to get rid of it. So if you have that is your sign that that food you're eating is not tolerated well. Some of the best ways we can do it is that you have different labs. So you guys want to do all these labs, like Genova has good labs. Biotech, I think it's BIO. Did they spell the name? I think it's TEK. I believe it's Biotech out of the Northwest. There are good pinprick tests now that test your blood for food intolerance. Some people say, well, I don't really trust them. I get that. But in a general notion, there are good urinalysis tests and there are good blood tests out there that have been pretty good at finding out if you're food intolerant. The reason being is you just want to find out what is causing the inflammation. And if you can abstain from those foods for the meantime while you're clearing out the SIBO, it will help you a ton. So look into Biotech, B-I-O-T-E-K. If I spelled it wrong, I apologize. There's also Dunwoody Labs out of Georgia. There's ALCAT, A-L-C-A-T. Now, you don't have to follow these forever, just maybe 4 to 6 months. And I know they can be a little pricey, but if you can get and take the relief off your system, that'd be really great. My friend, Dr. Anise, he is Acupuncture Fit on Instagram. He has a really good food allergy test. You may want to message him. I can't remember which one it is, but he has one that's been helping his patients tremendously. So you can use those and find out. So I always recommend that patients, when they have SIBO, to avoid these. Dairy, I love when people send me great information about raw dairy, and I'm not against raw dairy. I'm saying that dairy in general has galactose. It has some sugars in it, and it'll feed the small intestinal bacteria if you're not careful. Some of the good bacteria can help balance it. I get that. I understand that. But I always do recommend people stay off of cow dairy. They stay off the wheat and the grains. And I also recommend that they stay off corn starches, corn syrup. Corn, wheat, and dairy are my top. Then I say don't do those, okay? Soy, yes, I would say recommend that. But I would say those in itself can cause a lot of issues. There are certain types of starches too. So look at pea starches as well. Pea starch, because everybody loves pea starches, but it can have a lot of carbs in it as well. So pea, corn, wheat or grains, and dairy. Those I would really try to knock out right now as you clear out the SIBO. And as you start to heal up, you can start to do a little reinoculation, putting in some good probiotics back in the system, and it will help after you clear out the SIBO. In a nutshell, if you have food intolerances and you help clear up the SIBO, those food intolerances will go away because you help reinoculate and heal the gut lining where your body can dissolve and digest and absorb better because you helped heal the gut lining. You help restore some good vibrance to the gut flora. So it's important to get these critters out of the way, whether it's strep or Klebsiella or any type of chlamydia. There is a lot of chlamydial pneumonia type bacteria in the gut. Clostridium is there as well. You can have Pseudomonas. All these things can be in the gut, causing a SIBO type of effect. So clean out the SIBO, get rid of your food allergies. I see it all the time. Kids are able to eat more food because we clean out the gut. With children, though, I want to keep it nice and easy. With SIBO, I always recommend that we do homeopathic because homeopathics are least invasive. So that's why I love DesBio. You can find homeopathic companies like Professional Formulas. Professional Formulas is a good one. You can look at herbal tinctures from Hawaiian Farm, P-H-A-R-M, Hawaiian Farm, that have good tinctures. And they have as many herbs as Supreme Nutrition products. So Hawaiian Farm, I recommend that a lot. And there's some with glycerin or no alcohol in them, which is great. But for DesBio, you can take the homeopathics and burn the alcohol out of them. They have instructions how to do that. But if you use DesBio homeopathics and use Hawaiian Farm tinctures, you can use liquids for your children. So what I do for the homeopathic, if there's a few homeopathics, I usually will put 1 to 2, maybe 3 in the same little thing of water and drink the water. Has a little bit of a taste to it, but not horribly. Some homeopathics say don't mix them. I'll mix 2 to 3 at a time, and it seems to do pretty well. So for children, I just put that in water, a little thing of water, have them shoot it real quick, and that can help. Usually don't have any problems with it. If they have tinctures, I'll take those liquid tinctures and put them into some kind of juice they like to drink. So I say get them the tinctures for the SIBO that we just mentioned, those herbs. And also you can use these Candida or these homeopathics and take them out of the little vials, because these have little vials. You see they'll have little vials here. It's 1 through 10. For a child, I'll take them out and I'll tell the parent, take one of these vials that have the liquids in them, open it up, take an eyedropper or a little dropper and give the kid 4 to 5 drops out of this one vial. So you just take the dosages they recommend, and I always cut them down by half or a third. So I cut them down by half. I usually give a child about half or a third of the dose. And that's how you help with kids. And kids do great. Otherwise, I use a lot of light therapy on kids. I use red light. So if you're at home and you're a mom, get a red light box and do it lightly and gently. Don't ever go over 15 minutes. Start off small. Do 4 to 5 minutes on an affected area or on the gut. Do not go more than that with a child. Do that every day for 2 weeks and see how they respond. Do the points, rub the points out I recommended. Do the dosages at a very low dosage. These are just recommendations and suggestions. Ask your doctor, find a good homeopathic or holistic practitioner near you. Do that and see if this works. But you can use the liquids for the children. Hawaiian Farm, PHARM, DesBio, even Professional Formulas has some good remedies as well. The last question, what test would you recommend for SIBO or lower intestinal bacteria? Let's make it easy. Get an oats test. There's 2 tests, GI map test. You can do a GI map test, and there's also one called oats test. So oats test, you can get that from Mosaic Labs, and GI map test you can get from Genova, but just research GI map test for SIBO or oats test by Mosaic Labs, and they will give you indications of which fungus, yeast, strep, bacteria, type of toxins presence is in the body. The GI map test usually has a fecal test, so we'll see if it's in your lower bowel. And the GI map test will see if there's any imbalance within the bacteria, not only in the small intestine, but even in the colon. So that's the benefit of that test. But the oats test does really well too. It uses urine to find out if you have remnants of the toxins of mold or yeast or bacteria. So they both work. It's just oats use urine and GI map does fecal matter. You just have to choose which one you like. They both work really well. I like the oats test because it does extensively, tells you like what imbalances in there. It gives you an explanation. It tells you if you're methylating right, like in your liver. It tells you if you have a lot of infections within your gut. It tells you if there's a lot of mold in there as well. So those are 2 of my top, GI map and oats test. And when you get them, they do have good explanations on the website and how to read it. But this can give you an insight if there's a hidden infections lurking. GI map or oats test. Because if you can get that in your hands and you could take to your primary care and say, hey, this is what I've got. If they say, oh, don't worry about that, then I'm not trying to be harsh. You may want to find a new primary care or find a holistic practitioner that can work with it. Find the hidden infections. It's very, very important. Thank you for putting up with this nasally voice. I hope these answered your questions for SIBO. You can help your children. You can help yourself. Do these points, do these patterns, and take these herbs, the ones you think are the best for you, that resonate for you, and you'll see a difference. If you like this type of Q&A for the podcast, please let me know. And guys, it's so great talking to you guys. We'll have some information here on the on the captions. If you guys have any questions about SIBO and want more answers, let us know. We'll put more podcasts out like this. If you have recommendations for a podcast for Q&A that you would like to hear, let us know as well. Please like and subscribe. I don't try to push that too much, but if you can remember, like and subscribe and hit that little bell so that you're reminded every time a new episode's out. If you know anybody else, we'd like to grow it. We just want to spread the news. So if you have anybody that has this issue, send it their way as well. Anyway, guys, I hope this helps. Check those hidden signs and symptoms. From here at the Ancient Health Podcast, I hope you guys have a blessed day. Take it easy. Love y'all. Have a great day.